Did you know that people once believed drilling a hole in your skull could cure headaches? Or that doctors used to prescribe mercury for almost everything? Medicine has come a long way, but history is full of bizarre, terrifying, and even dangerous medical practices. In this video, we're diving into some of the strangest treatments ever used throughout history. You won't believe what people once thought was good for their health. One of the oldest surgical procedures ever recorded is trepanation, the act of drilling or cutting a hole into the skull. Evidence of this practice dates back to Neolithic times, around 7,000 years ago. Ancient civilizations, including the Incas and Greeks, believed that trepanation could treat epilepsy, headaches, mental disorders, and even possession by evil spirits. Some skulls show signs of healing, meaning that patients actually survived this gruesome procedure. But can you imagine enduring brain surgery without anesthesia? For thousands of years, bloodletting was a common treatment for almost any illness. Physicians believed that diseases were caused by an imbalance of the body's four humors: blood, phlegm, black bile, and yellow bile. To restore balance, they would cut a patient's vein or use leeches to suck out the bad blood. Even George Washington was treated with bloodletting before his death in 1799. Unfortunately, this practice often made patients weaker and more vulnerable to infections. Before antibiotics, mercury was used to treat various ailments, especially syphilis. Patients were given mercury ointments, vapors, and even mercury pills. While it may have provided temporary relief, it also caused severe poisoning, leading to tooth loss, kidney failure, and insanity. The phrase "mad as a hatter" actually comes from hat makers who suffered mercury poisoning from the chemicals used in their trade. During the Renaissance, many believed that consuming human body parts had medicinal benefits. People ground up mummies from Egypt into powder and drank it as a remedy for headaches and internal bleeding. Others consumed human fat, bones, and even blood, believing it could transfer vitality. Some doctors even recommended drinking the blood of freshly executed criminals, thinking it contained healing properties. In the 18th century, doctors believed that blowing tobacco smoke into a patient's rectum could revive drowning victims, relieve colds, and even cure stomach pain. Special kits with bellows were designed to pump smoke into the body. This bizarre practice was so common that the phrase "blowing smoke" is believed to have originated from it. However, when scientists discovered that tobacco is toxic, the practice quickly disappeared. In the early 20th century, lobotomy was seen as a breakthrough in treating mental illnesses such as schizophrenia and depression. Doctors would insert a sharp instrument, often an ice pick, through the eye socket to sever connections in the brain's frontal lobe. Thousands of patients underwent this brutal procedure, often becoming emotionless or permanently disabled. Even John F. Kennedy's sister, Rosemary Kennedy, was subjected to a lobotomy, leaving her unable to function normally for the rest of her life. Though still used today in controlled medical settings, early electroshock therapy was often brutal. Patients suffering from depression or schizophrenia were subjected to powerful electrical currents without anesthesia, causing seizures, broken bones, and memory loss. It was seen as a miracle cure in the mid-20th century, but was later criticized for its extreme side effects. Medical science has come a long way, but looking back at history, it's shocking to see what people once believed was good medicine. While some of these practices were based on superstition, others laid the foundation for modern treatments. What do you think was the strangest medical practice? Let us know in the comments. If you enjoyed this video, don't forget to like and subscribe for more amazing historical content.